Let's discuss diagnosis by visceral organs. We continue with liver illnesses. Liver wind stirring in interior. The generation of internal wind is related to imbalance of yin-yang in the tongue organs and is especially intimately linked to abnormalities of the liver. The principal symptoms are dizziness, tetany, or convulsion. Clinically, there are four main patterns: liver yang transforming into wind, extreme heat generating wind, yin deficiency giving rise to wind, and blood insufficiency generating wind. Liver yang transforms into wind, usually when liver and kidney yin have been chronically deficient, so that liver yang is unrestrained and induces liver wind. Extreme heat generates wind usually when exogenous heat is extreme and burns the liver meridians. Indeficiency gives rise to wind, usually during late stages of exogenous heat illnesses. In these stages, fluids have been severely damaged and the tendons and channels have lost nourishment. Wind arises in blood insufficiency, whether massive blood loss or prolonged decline in chronic illness, usually because blood can no longer nourish the tendons. Clinical manifestations. Liver yang transforming into wind. The main symptoms are dizziness, heaviness in the head, and lightness in the feet, headache on shaking the head, stiff neck and numb limbs, tremors in the hands and feet, and stammering speech. The tongue is red and the pulse taut and thread-like. Alternately, the patient faints suddenly with tetany or convulsion of the hands and feet. Or there are wry mouth and eye deviation and hemiplegia. Extreme heat generating wind, the main symptoms are high fever, dull sensorium, tetany or convulsion with opisthotonus when severe. Rolling up of the eyes and clenched jaw. The tongue is red or crimson with yellow coating. The pulse is taut and rapid. Wind arising in yin deficiency, the main symptoms are tremors of the hands and feet, accompanied by symptoms of liver insufficiency. Wind arising in blood insufficiency. The main symptoms are numbness of the body and limbs, spastic flexion of the joints, tremors of the hands and feet, and symptoms of liver blood insufficiency. Cold congealing liver meridians. This condition is mainly due to invasion by exogenous cold. When the cold evil congeals the liver meridians, yang qi is thwarted. The tendons go into spasm, and the movement of qi and blood becomes impeded. The typical syndrome includes cold pain in the lower abdomen radiating into the pudenda, or painful contraction of the scrota, worsened by cold and alleviated by warmth. The tongue coating is white and smooth, and the pulse deep and taut or slow. Dampness heat in liver meridians. The syndromes of dampness heat in the liver meridians are due to impairment of the dispersion function of the liver caused by dampness and heat gelling in the liver and gallbladder. This condition mainly arises from attack by exogenous dampness and heat from overindulgence in greasy and sweet foods or from disharmony between the spleen and the stomach with rise to endogenous dampness and heat. Gelling of dampness and heat in the liver meridian compromises the dispersion function of the liver and the gallbladder and the ascending and descending functions of the spleen and the stomach. These in turn compromise the digestion of foods and the distribution of essential nutrients. Clinically, this is also known as the syndrome of dampness heat in the liver and the gallbladder. There are several patterns of symptoms. In some patients, there are distending pain in the flanks, anorexia, abdominal distension, a bitter taste, and nausea as though about to vomit. In others, there is jaundice. In yet others, there are alternating chills and fever. In males, there may be burning pain and swelling of the testes. In females, there may be yellow, malodorous, vaginal discharge with vulvar itch. In all these patterns, the tongue is red with yellow greasy coating. Pulse is taut and rapid. Thank you for your attention.